Health is one of the most important milestones in an individual and a country's well-being. Through an adequate level of life expectancy and health services, a country can produce far more prosperous and qualified human resources. My name is Kris Mathilda, standing here as the representative of Telkom University for the most outstanding student selection of 2023. Today, I would like to present Indonesia's healthcare system from a wider perspective, starting from its quality, inclusivity, and technology adaptation scope. One of the modern health innovation is telemedicine services, a one-stop solution for people to get a quick access to healthcare and medicine through internet and mobile devices. According to industry report by McKinsey & Company in 2021, telemedicine services in Indonesia have a significant growth and expansion in terms of user and activities in urban areas such as Jakarta and other big cities. During the COVID-19 outbreak in 2020, telemedicine services also show a rapid escalation, since people are not able to go out as many of them are infected by the virus. And even in the post-pandemic situation as today, telemedicine is calculated to stay at people's top of mind for easy and economic healthcare access, with a total of user retention rate around 101% per year, based on telemedicine statistics by Dentones. This shows that telemedicine is now becoming one of our crucial health service infrastructure. However, we shall not forget that there's still a huge gap to realize an inclusive health service for everyone, meaning that the advantages and the disadvantages, with no distinction or border between them. It is ironic that almost all rural areas in Indonesia have no access to telemedicine services. With that being said, we can see that there is an exclusivity in Indonesia's healthcare system. Therefore, to answer the issue, I developed a project called HEALTHBOT, a hybrid innovation of today's existing telemedicine and an automatic robot system often used in call center services. HEALTHBOT will help those who only receive cellular signal in rural areas and unable to access internet broadband within the zone, by providing an automated call center that will help system to record patient symptoms, send patient data, diagnose to nearest health center, connect the patient with doctors on duty, and manage prescription detail. First, patients in rural areas could dial the HEALTHBOT hotline or send an SMS with specific format to help the system robot record the patient's general data, location, and needs. The central operator will receive the data within minutes and transfer the patient phone number to the nearest health facilities partner in order to provide a consultation or checkup session. The health facilities brand will dial the patient phone number with the doctor on board and start the two-way dialogue, just like an original telemedicine system, in order to identify and diagnose a patient disease. Doctor then will prescribe a prescription delivered by standby HEALTHBOT courier to the patient address as soon as the discussion ends. Moreover, with this mechanism, patients in rural or suburban areas with limited internet connection will be able to access real-time healthcare services and a consultation with doctors only through cellular signals that certainly have a wider range than internet signals. Comparatively, the existence of HEALTHBOT will not only complement the current telemedicine service, but also to fill the issue of gap between health and supply demand through system adjustment and adaptation. HEALTHBOT may truly cover all the opportunities and weaknesses that rural areas have, making those who live there at least have their first chance to experience a health technology solution. It also will not only support a first aid and one-stop solution for marginalized people in accessing doctor and medicine, but furthermore, with HEALTHBOT, accessing health services is now as easy as sending text to relatives. As one of the nations with the highest population in the world, Indonesia should be home to unlimited innovation for a more sustainable and peaceful society. Hence, HEALTHBOT could be one of them, to help raise the nation's awareness on inclusive healthcare importance and embrace human beings through humanity action. Surely, there's still a lot of gap to fill and more holes to hoard. But the key is to not only we all compete to produce the best idea or innovation, but to also gather our hands together and create a strong association bond for both our nation and people. Lastly, may we as a youth keep deep diving into our final sustainable goals and striving to invent the world's most inclusive healthcare system ever.